Could there be something structurally wrong in your mouth that could be causing other issues in your body? Let me rephrase that. Could your back pain, could your headache, could your body aches be associated with something that's going on in your mouth? Well, today in the classroom, we're really fortunate to have what do I call her? My Swiss Army knife of dentistry, my mouth whisperer, whatever it is that she is. Dr. Claire Stagg has incredible answers. She has been able to get out of the mouth, look into the whole body. And today she's going to talk to us about how we are connected from head to toe. So take out your pen and paper because we're going to learn and grow together. Class is in session. Here we go. And when you need a friend, you can count on me. I'll be right here waiting for you. Hi, my name is Lily McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show Classroom. If this is the first time that you're tuning into the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace the new truth and live the life of your dreams. So, we've talked about this in the past, and I'm just going to share. Might be too much information, but this is something that I've been living with for the last since I think May of 2024. It's called a orthotic for my mouth. You've seen people walk around with one shorter foot with a bigger heel than the other leg or whatever it is. And they have this orthotic put in their legs or whatever, or wherever they need any extra help with. For me, it's because structurally something is wrong with my mouth. And I've been working with Dr. Claire Stagg since May of 2024. And I am really excited that today we're going to be talking about the structural importance of our mouth. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Claire Stagg is here to do just that. Welcome, Dr. Claire. Dr.
Hello,
Stagg, how
Lily.
are you?
Good. And you?
I am well, thank you. I took this off before we got started because I don't want to sound like Sylvester the cat saying suckering succotash. But let's go straight in. And by the way, if you haven't gotten your copy of Smile, It's All Connected, it's time. Everybody is getting this book, and it's, I think, a top seller, right, on Amazon.
Yes, it started off as the number one in dentistry when it first came out.
Perfect. And I'm sure it continues to be there. So let's talk about the importance of making sure is it symmetrical that we want our mouth? How does this cause other parts of our body to malfunction? So take it away.
So where do I start? In the book, and this is where the book is so beautifully laid out. We have past, present, and future. And in the past, there's a doctor called Dr. Al Fonder who literally discovered and shows that the body is connected from mouth to toe and vice versa. And he wrote a book called The Dental Physician. So he also worked with engineers, and there was a young fellow at the time called Gouze. So he created the theorem of Gouze. And what they showed is that the axis of rotation of the bite is not to the jaw joints like dentists are trained in school, but it is actually at the atlas of the neck. So what happens is I always go ahead and tell patients, think of a fulcrum, of a seesaw, right? So if you have the fulcrum in the middle, so think of the body now this way. If you have the teeth and the mouth hair and the atlas at the neck hair, which side is the baby and which side is the sumo wrestler? So if you think about it, you have 32 fulcrums with the teeth. All right, you have all these muscles that can create functional dysfunction or mechanical issues. You have teeth that may or may not be fitting the right way, all these create a total either harmony or disharmony within that part of the equation. Then you hit the neck, so to speak, and then you have the whole body. Now, again, the neck, that fulcrum, is it healthy? Is there a disconnect there? Have you had an accident? Is there a neck problem? Is your neck straight? Is it kyphotic? Is it lordotic? All those are terms that the chiropractors understand because the curvature of the neck, you should be able to have a dinner plate in the neck where it belongs. Then you have the whole body, all the way from the atlas down to the toes. Did you know that the fascia from the tongue goes all the way to the fascia? It's the same fascia all the way to your toes?
That's a pretty long tongue.
Long way. And there are nerves that go all the way from your mouth all the way down to your intestine, the vagal nerve, for example. All right. So
Wow.
you have an emotional nerve that also is a sensorial nerve that also is a motor nerve. It's an autonomic and reflex. So there's lots of different connections that continue all the way. So what happens is Dr. Fonda was helping heal all his patients by correcting their bite. And then he found that they were getting better, and he thought, oh, well, it's just a psychological healing process. Lo and behold, what he realized is he was actually making the patients level, and it wasn't, psychological, or I'm spending a good time with my patients, we're listening to their concerns. No, it was actually a rehabilitation process that he was doing to where that fulcrum was more balanced and level. So actually the book, the name Smile, It's All Connected, Whole Health Through Balance is actually a play on the words with balance and actually being level because your body is always going to seek balance. All right. So he realized that when he was having these patients get better, all right, they would move on. And then he had his health deteriorate more and more and more until he decided, well, wait a minute, I should practice what I preach, had his bite restored, and then a lot of his symptoms went away. Now, these symptoms could be neurological, they could be autonomic, they could be mechanical, they could be muscular, they could be hormonal. A lot of patients could have headaches, they could have pain, emotional outbursts. There's so many different things. On my website, Health Connections Dentistry, I actually have the whole theorem there. I also have his whole paper, so you could actually see all the connections. And there's a very brief synopsis in the book about what the connections are. It's very fascinating, actually.
As you are talking and you're showing this, you're saying the teeth are here, but this is the this is the back of the mouth. This
No, so
is
this is the mouth.
the
This is the
front of the
mouth.
mouth.
So let's go ahead and let's look at Fred.
Yes. Okay. I
I
like
always have
Fred.
one.
You're
Oh,
gonna have to bring
I
Fred
was,
up.
yeah, I always have one that's attached close by. Well, he just got disconnected. So, all right. So this is my skull, if you will, and that's the googly eye for Halloween ready. So this is what I was trying to tell you. So you have, it's a little heavy. You have 32 teeth, and then you have the jaw joint, but in effect, you have the atlas that is right there. See it?
Yes.
That is the first vertebrae. All right. So if you think about it, it's very hard for me to hold this and to talk. But if you look at that one too, let me try and see if I can move it. This one. All right. So you have the same thing. You have the teeth right there, right? Then you have the jaw joint right up here. I'm going backwards. And then you have the neck. So all this forward are the teeth, but the atlas is where you're going to have, it's very awkward. And I work in indirect vision all day long, but this is backwards. All right, that is where you have the fulcrum. So when I go ahead and I do this,
Okay.
that is
No.
basically right there,
And exactly that's what I understood. Because
right there.
I wanted to make sure that you weren't reversing it and this was actually the front of the mouth. This is the back of the head. And when you're going down this way. Okay. With that in mind, when somebody has some structural, you said there's either neurological, autonomic, mechanical, muscular, hormonal, I don't know if emotional. I don't know what other aspects that can cause this, but when somebody has dysfunction in the mouth, will it always manifest in other parts of the body, or can it go without being noticed? Can it go without being no pain or
It
anything?
can, it can. So what happens, and I always explain it very simply, you have what we call the adaptive range. You're in the womb, you are hopefully fed well, you grow well, everything, all the components should be put together to where you develop healthily, right? And then you come through the birth canal. Is it an easy birth? Is it a difficult birth? Was it traumatic for the mother? Was it traumatic for the baby? The baby is born. Was the baby nursed? Was the baby held appropriately? Was the baby hurt? Was the baby dropped? I mean, all these different things, all right? And then we grow. So when you come through that birth canal, let's say you start off your life, you have what we call an adaptive range. Think of them as goalposts, all right? And so on the outside of these goalposts, everything that's on the outside is where you're fine. These could be things that are developing, but you're symptom free. You may have the signs of an issue, but you're symptom free. And then you have a little trauma, you have a little fall, you have a crown done, you have a tooth missing, you have a filling that's too high, you have something that happens. So there's two different things. There's a naturally occurring episode, or there's what we would call iatrogenic care. Iatrogenic care is if it's dental care, for example, there's actually detrimental to you. All right. It harmed you and didn't help you. So if you go ahead and you look at the goalposts, all these things are items that you compensated for. Well, as we age, these compensatory changes they tax the body a lot more. So all these things eventually add up. It's a drop plus a drop plus a drop plus a drop plus a drop. And it gets to the point where eventually you cannot adapt anymore. And that's what we call a breach of the adaptive range. So you no longer can adapt, and everything that you compensated for now actually becomes symptomatic. So people say, oh my God, getting old sucks. Well, it's not that you got old. You could have a 6-year-old who will have these symptoms, as you can have a 90-year-old who never will. Why? Because their adaptive range has not been breached.
Mhm.
Whereas the child, if they've had allergies, if they have nasal passages, if they have a lot of forward head posture, they're not breathing through their nose, or they've been through trauma, those 6-year-olds or 7-year-olds, they will have a breach of their adaptive range and they will be symptomatic.
So if somebody goes to a chiropractor, because like you said, it's all connected. And I've noticed that there are times where you go to the chiropractor and you feel great after you're all done. And other times it seems like it's a temporary fix and it all goes back. So if
Mhm.
somebody has let's say, and I truly embrace upper cervical
Of
chiropractors.
course,
Yes,
of
and so that
course,
C1 is so important, and I've been
of course.
drilled in my head.
Yes,
But if that chiropractor doesn't know about the misalignment of the mouth, will
back
their
again.
will their work be as meaningful as if they work with someone like you?
Right. So this is where it's really important to understand. So I usually have two highlighters. Think of these two as bones. All right. And then you have a muscle. So a bungee cord around the bones. You go to the
Mhm.
chiropractor, they adjust the bones, but the muscles are so tight that afterwards it goes, brings them right back to where they were, right? Or you get a massage and then you feel so great, then you get off the table, but those bones weren't where they were supposed to be. Brings it right back, and now you have tension as well as malpositioning of the bones. All right, so they need to work concomitantly. What I say, and synergistically, what I say is that get the variables that we can control out of the equation, that fulcrum, if you will, get that sumo wrestler out of the equation so that now the atlas is not being pulled taut, and then you can balance out. All right. And so that is what is so important to go ahead and to determine what is primary? So, for example, is it ascending to where it's from your feet up, or is it descending? Is it from your bite down? That's really important to know.
Can
Otherwise,
can
you're
you
just shooting.
explain that? Can you explain the difference between a condition that is ascending and a condition that is descending?
All right. So, ascending, it's from the foot up,
Yes,
and descending, it's from the head down.
yes, but
So, it's really important that you know what you're doing. Otherwise, you're just throwing stuff at the wall and hoping something will stick.
no, no, I understand that. But can you give an example of what from the foot up means? Is there a condition? Is
Oh,
it like a
yeah,
limp
surely.
or
Sure.
can that's what I mean.
Right. So, for
Okay.
example, in my thesis, when I was writing my thesis for my master's, I did a lot of research on structure because actually this is something, might as well bring it up right now because that was a massive um, um, component of the book Smile was showing how it was all connected because at Tufts, my dean, when I was doing my master's, my subject that I was supposed to research was how changing the vertical dimension of your bite changes the direction you walk in. All right. And I never thought I'd graduate because I couldn't find the data to prove it. And so Dr. Mehta, my dean, kept saying, Claire, that's why you're doing this. Because in the clinic, we actually do this in order to go ahead and to show that one side was higher than the other. They'd put a cotton roll on the other and then the patient would walk straight because it leveled the bite. Just as like when I have you walk down the corridor, remember at the
Yep.
office, it's
Yep.
the same exact thing. That's the principle. That's what my research was on. How when you have it level, you function, you level. So
Yeah.
your body doesn't have to be in chaos thinking, oh my God, where am I going? Am I going to fall flat on my face? All right.
Yes.
So an ascending component, for example, would be somebody who has a foot problem,
Okay.
somebody who has a knee problem, somebody who has a hip problem. Well, we found out that very rarely do you have a leg shorter than the other. Usually it's the hips that are rotated. All right. Okay. Very seldom do you have, you may need a lot of chiropractors who say, oh, we'll take care of that. Just let's put an orthotic in your shoe. But then that leg may not have been quote unquote derotated. So now, you're just I don't want to say that you're adding insult to injury, but you're treating symptomatically as opposed to root cause treatment. All right. So it's always important to figure out what the root cause is and then go from there. You can have patients that walk in with a bag of splints. I've never had that honor, but I've had some of my mentors say that patients would walk in with a bag of splints and say, you're not going to make me another one. I've had 20 or 30 of them here. Nobody's been able to help me. What are you going to do that's different? Well, there you go. In reality, they never got the root cause and they were addressing this issue when in reality it might have been a foot or a hip problem. And therefore, the patient was in so much pain and the body was trying to compensate for the ascending problem. And so they were clenching and grinding and had horrible neck issues when in reality it was really the structural problem. Now, mind you, we still have to address the fact that they're clenching and grinding, but the design of the appliance will be different. It's not just a piece of plastic, which is you
It's
pay what
not.
you get for, you get what you pay for. So let's say you go on Amazon and
I
you
have,
get a
I
piece
have
of
to show mine. I don't know if you can see this, but do you see that little section right here? That little section right here where it's higher than right here. And
correct,
so that is something that this orthotic plus it has all these little like I don't know, it gathers, it grabs my teeth so that it sits it in place. But this is
right,
my lower orthotic because I don't call
correct,
it a splint. I had a bag full of splints, but I guess my adaptability ended this year when I started
right,
getting really bad temporal headaches. And of course, I went through a lot of testing with Dr. Stagg, and we decided to do something just what you call static. It's like,
right.
I'm not going to change my bite. We're just going to put the orthotic in. And so with that, my headaches went away, and then I know that it's that my bite is higher on one side than the other. I would have never,
because
and no one's ever said
because you're not level. You're not
yeah,
level.
nobody has ever said that to me, Dr. Stagg, no one. And so I know that when I work out in the morning, I work out with my orthotic. I don't care if I sound like Tweety Bird or Sylvester the cat. And
Right?
so I just want to make sure that if I'm working out, I want to be strong. And I've seen how straight I walk when I have a properly aligned orthotic in my mouth. So
True.
I can tell when you have me walk in my orthotic, if I'm veering off to the left or if I'm veering off to the right, you know where you need to adjust.
Exactly.
How is it that you need to adjust after all this time? What does the jaw gets comfortable and relaxed or what?
Well, everything. So everything shifts now. Remember, yours are more static, therefore you don't really have much cranial movement per se. But if you were to have, for example, an ALF or something that's a little bit more cranial friendly, things shift. If the bones shift, the muscles shift, plus the fact that you're not under duress or stress or pressing down like that,
Mhm.
everything changes. Well, that's going to go ahead and affect the way that you close. Now, in theory, one thing that Miss Miss Lily's supposed to do that she doesn't is she's supposed to eat with her orthotic, and she doesn't.
You can
But
rat me
that's her
out. You can rat
choice.
me out.
So
I
it's like
am a very difficult patient.
so when you break a leg, for example, when you break a leg and the doctor puts the pieces together and they cast it and then you wear crutches, you just don't decide to get up and go walk down the street to go grocery shopping without your cast and crutch. You have it on totally all the time, 24/7 for 3 months, for example, until the bone heals and it readheres and then it just is seamless, right? It's
Mhm.
the same thing here. So as the decompression occurs, then you'll have a differential. Very important to understand is that the jaw joint has the disc. So this little disc right here, that's right there, you can see it, this little thing that moves right here. All right, that is the size, the width of a quarter. All right. So every time you open and that disc goes forward, you clonk back on that disc because it's forward, it's displaced, it's anteriorly displaced. Usually the discs are either anteriorly displaced or medially displaced, and that's more towards the inside, but they're forward because the ligaments are stretched. All right. So what we do is when we make the orthotic, we actually bring you back onto the disc, and so every time you open and close, you have that seamless motion. You're always on the disc. All right. Well, that's a heck of a lot of difference to all the nerves that are sitting back there, the nerves and the blood vessels. Because if you don't have that disc that is always compressed by the bone, that bone is compressing the blood vessels and the nerves, and that's major ouchies. You don't realize. Now, there's a doctor, Dr. Brendan Stack, who was an orthodontist who went ahead and showed he was prepping for a conference, all right, and for his pairs. And he realized that all his TMJ patients, once he went ahead and he had them in their orthotics, their tremors went away, their tics went away, their issues went away to where they had motion disorders. And he wrote a paper with Dr. Tony Sims, all right, Anthony Sims, showing that the cranial nerves, the fifth, the seventh, the ninth, the 10th, and the 11th, which were the ones that sort of wrapped that. Okay, let's start really simply. This jaw joint is innervated by several nerves, the main one being the fifth cranial nerve by a little tendril called the auricular temporal nerve. That is the fifth cranial nerve, the trigeminal nerve. That is the biggest cranial nerve in the entire head. All right. That little, you know how you have a circuit board or you have a electrical wire? All it takes is one little tendril and then it goes to the shoots to the motherboard, and then the whole thing lights up, right? So it's the same thing. When that little tendril from the fifth cranial nerve anastomoses, which means that it joins with the seventh cranial nerve, which is the face, the ninth cranial nerve, which is the tongue, the 10th cranial nerve, which is the vagal nerve, and the 11th cranial nerve, which is the supraspinal one, the one that shrugs, then you can understand why people who have tics, who have that voice tic, who have that shrugging tic, who have the blinking tic, who have the all those cranial nerves that come in, they're unable to control them simply because they're uncontrollable, because the nerves are firing without you being able to stop them. It's like, can you ever stop a sneeze? Those
You
are
know, some people
premonitory
try, some
signs,
people try, some people
right?
try. Yeah.
So he found that when he went ahead and put an orthotic in there to where he got that disc reduced, which means he put the appliance in to get the disc back in place so that the nerve was not impinged on, the tics went away. So then
Interesting.
he started treating TMJ disorders that had the added benefit of helping alleviate Tourette syndrome
Wow.
disc, Tourette's tics. The other thing too is that a lot of people who had accidents, trauma were also helped. So I would suggest you go to Brendan, Brendan, Stack, Stack. All right, he was in Virginia, in near Washington, and he actually has hundreds of YouTube videos. The man, he's passed on now, but he is such an inspiration. And I had the honor of being right behind him in my Academy of Craniofacial Pain. He was STACK and I was STAGG.
Gee.
So every time there was a line to do something, Claire was behind Dr. Stack. And I was like, I adore you, I adore you. And he said, yeah, I always had a soft spot for blondes. So we always used to laugh and joke, you know. But he was an inspiration to many, and he made a point of sharing all his knowledge with everybody. A couple weeks ago, I went to the IOMT meeting in Washington, and Tony Sims actually lectured, and he brought all this back up. There was not a dry eye
No.
in the room. You
Mm.
had kids that were like shrugging and very made fun of and traumatized, but they can't help it. But they were actually helped by having the appliances put in there. It's really a phenomenal thing to think how much we
Is
could affect lives.
is it because it is sending the right signal to the neurons, like the because I remember talking to Dr. John Silva, who we just did an event with rewiring of the a brain with neurofeedback training. He completely understood why I walk straight when my orthotic is balanced out properly. And he said that's because of the neurons start firing correctly. And there's an association, and he talked a little bit deeper, and I went, oh, deer in the
So,
headlight.
all right, so it's more importantly, the nociceptive or the negative effect is no longer there. So they are not firing incorrectly.
Got it. Got
So
it.
it's like if I keep scratching you, you're gonna get an irritation.
Mm-hmm.
Or are you really gonna feel good if because I stop scratching you, or are you gonna feel good because there's no scratching?
Mm-hmm.
It's the nociceptive effect is no longer there.
Yeah.
Plus, you have the fact that you're now going to heal. So if the joint is reduced and you no longer have that pressure on that nerve, then that means that the muscles are going to be relaxed. The jaw joint is back on the a disc. And then more importantly, a lot of times these patients, because they are, and this is a big thing, I'm going to add my airway component, because they can't breathe, they're going to be like this too. So now you have that neck issue going on, right? Okay. So if you go ahead and you consider that when you reduce the disc, you're bringing the jaw down and forward. They're going to breathe better because now the airway is open. Now you're getting a double whammy. They're breathing better, their posture's better, they're up straight, and then you walk straight too, right?
Yes, yes. So, okay, we just talked about ascending, which is from the feet, the hip, the knee, the foot, the knee, the hip, the knee, or whatever. And so you're ascending. What would be considered descending? I know it's from the top to the bottom, but can you give us an example of what would be off when it comes to ascending? Does that mean that your mouth is
Descending.
I'm sorry,
All right.
descending,
Right,
descending.
right. So it's everything we just talked about. It could be the teeth, it could be the
Okay.
muscles, it could
Okay.
be the bones, it could be the airway, it could be the neck,
So that would
it
be
could be
from the
the
top
tongue,
to, okay.
everything. So again, which part is it? Ascending would be the spine,
Yes.
everything connected to the spine, and then the descending would be everything that would be in the mouth, in the head, down.
Mm. Interesting. Interesting. Okay. So you've talked about posture several times. So, if somebody has poor posture, could that be a structural problem in the mouth as well?
Oh yeah. Oh yeah. So again, so we talked about forward head posture, for example. So if you have a patient, so remember, I don't know if you remember, but when you came in to do your exam, I know we do things a lot more than you'd ever expect from a dental practice. But when you came in, we did a thing called the symmetry graph, to where we put you behind a grid, and then we actually took pictures of you behind this grid to see which shoulder was higher, which hip was higher. All right. Then we had you turn 45 degrees, 45 degrees, 45 degrees, and back again. So we saw from the front and from the side which part of you was not level. Again, back to being level, right? When we look at you forward, we can see the disparity between the shoulders, the hips. When we look at you from the side, we can see, is the air aligned to the shoulder, aligned to the hips? So if you have an airway problem or a joint problem, you're going to compensate. So that's what we call forward head posture. Well, think of the head as a bowling ball. That bowling ball can weigh up to 15 pounds. So every centimeter forward, you're talking 15 plus 15 plus 15 pounds. That puts a heck of a lot of strain on that cervical spine. All right. Now, the cervical spine is being held and supported by ligaments, by tendons from the muscles, as well as also the aponevroses, as well as also the actual tendons that encapsulate it. So if you think about it, you have that cervical spine that's supposed to have a certain shape, but if it has a lot more trauma, it's going to eventually capitulate. All right. So a neck, an ideal neck, if you were thinking about it, so an ideal neck should be able to hold a dinner plate inside. That would be a lordotic neck. If you have a super, I'm going to exaggerate. If you have a super straight neck, well, we could call that a military neck. And then the exact opposite, instead of being like that, it's the exact opposite where it's like that, then that's called a kyphotic neck. All these are chiropractic terms. All these are terms that the chiropractors are familiar with. Dr. Singh, who did the DNA appliance, who created that, showed that there was a massive correlation between the bite, the head, as well as the atlas. That's why I have a ton of atlas little things in my practice. They're all over.
Yeah,
I have a
yeah.
lot of skulls.
Yes, yes. I was worried that I would be one of yours. Later
No, you not to
on,
tell.
and this is the lily skull. Uh,
No, you keep yours on your head. But then there
okay.
you go. So this is
Whoa.
this is the cranium, and then you could see the major importance of how the atlas fits in there. This is really cool. I mean, patients get it when they see it. It's like, oh, oh. And then now they figure out, okay. So yeah, that's what
So
I do.
patients get it when they see it, and I get
Yes.
that. Um, you had mentioned the kyphotic. So if somebody
I
has the
want to show
straight,
you all the muscles. You can
okay,
see all the muscles. That's pretty
yes,
cool, right?
yes, yes. So if somebody has a kyphotic neck or a military neck or a neck that you could fit a plate, can that be corrected?
It all depends we always go back to the root cause. All right. It's not going to be just one thing. It's going to be a drop plus a drop plus a drop plus a drop. So
Mm.
if you go ahead and you have an airway issue, a lot of times, a lot of the issues will be airway. You're compensating. You got to breathe to survive.
Yeah.
All right. If you don't breathe, you're dead.
Yes. Yes.
Okay. So you need oxygen to survive. How much oxygen you get is whether you survive or you thrive. All
Mm.
right. And that's where the dichotomy really, 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 really is important to understand. There's one thing in your head, in your mouth, that's so important, and that's tongue and tongue space. Whether you breathe and you thrive or you don't breathe and you survive, is the differential is the tongue. It's the amount of space that it has, and the tongue is the one that actually creates that palatal shape, if you will, because the palate is the floor of the nose. So
Mm.
if you're not breathing the right way and your mouth breather, then that palate becomes super, super, super narrow. All right. Super narrow means that there's no room for the tongue. You're going to have low posture and forward. And then you have everybody walking around like, there's some really good pictures. It's really sad because it's always the same guy they pick on. It's a young man. He has these big glasses and he walks around like his
Mm.
mouth hanging open all the time.
Yeah, but he probably makes a lot of money.
I don't know if it's a stock picture anymore,
Okay,
but
okay.
yeah.
Yeah, well, it is. I'm not trying to make fun of a abnormality, but sometimes people pose like
Actually,
that
it's not
too.
an abnormality. That's the whole thing. It's not the norm. So it's not a dysfunctional, well, actually it is a dysfunction, but it's not an abnormality like they were created not the right way. It's not the norm to not be able to breathe through your nose. You don't eat with your nose, right?
No.
So why do you try breathing through your mouth?
Mm.
So if you have a patient, so I have another one here. And I know I have a lot of demo things. I don't know, I know it's a lot of glare, but you see the exercises that you can do with your neck.
Yes.
All right. These are all the muscles that we work with. I mean, we work with a lot of muscles and a lot of nerves. The whole idea is to figure out, you remember I palpated, I don't know how many muscles, and I still palpate every time you come to figure out which ones are not
Yeah,
holding up the right.
I think you're the only one that really knows my mouth so intimately. I mean, you've stuck your whole fist in my mouth, it seems like, trying to get to certain areas of my mouth, the muscles and all those areas
Right,
that I never even knew hurt until you
right,
touch them, until you touch them. And so we know you know where to find whatever is
right.
wrong with me.
Right.
Yeah.
And that's going back to the root cause. So if you know that you have a problem, if you have a muscle that's hurting, all right, that muscle has a specific function. So
Hmm.
for example, if you have an elevator muscle, that's the one that opens and closes the mouth. If that elevator muscle is sore, then that's the one that's going to fire up and hurt when I palpate it. What
Hmm.
does that mean? It means you either have too much vertical or not enough vertical. If you have a muscle that makes the jaw go side to side, all right, and it's sore, then that means that you have what we call an interference, which means that you're supposed to be able to go right to left because that's how you chew, all right? If you can't go right to left without hitting, which is your case, Lily, you are going like this. When you go side to side, nothing should touch. But your crowns, because you had one, is it okay to talk about your case?
I don't know. What are you going to say?
No, no, I'm just, it's the
Sure,
same
sure,
thing.
sure, sure, sure.
If you go ahead and you have a crown, let's say, and this is common, this is not just necessary Lily. So let's not put Lily in the equation
I'm going to
anymore.
be the stock girl like this.
All right. But let's say, for example, you had a crown done 20 years ago, and then you broke a tooth in between an accident happened. You've got another crown done and another one. But it was all done at variable times. And so they're not quite in conjunction, and there's not an actual final game plan, right? So
Hmm.
everybody's doing their own thing. Well, somebody is going to hit before they hit the others, and that's going to put undue stress. And that was, remember, one of the things you came in and they said you need a new crown. Blah, 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 blah. I was like, whoa, let's just go ahead and let's figure out why this is happening. So instead of going through the expense of doing everything over in your mouth, let's just make sure we know why you're having pain.
Hmm. Yeah, yeah, no, it's been an interesting journey with Dr. Claire Stagg, and we've done a lot of classes together, and we are coming to the end of my first initial treatment, and I'm going to be receiving my either my walking papers or my papers to what I need to do next. And so I noticed that this is the only time that I've ever been treated for TMJ. I've been told since I was younger that I grind my teeth or that I talk in my sleep or that that I have TMJ. At 24 is when the doctor said you have TMJ, you need to sleep with a splint or else you will grind your teeth. And so at least I didn't grind my teeth. I grind the splint all the way down until I
Right.
continued to. But anyway, I want to encourage all of you to go to some of these past classes and go to
Yes.
whenyouneedafriend.com. While you're there, please and follow me on social media. Please subscribe to my channel, my website. It's very important that you do that. Why? Because just this last week, I've had 5 videos removed from my website. So we're trying to migrate everything, not my website, I'm sorry, YouTube. And these are videos from 2017. So they're combing my website so that everything that is holistic is gone. So when you're doing research from this point on, please go check out my BitChute channel because those have most of my the classes that are more holistically inclined, where we can speak the truth without feeling censored. So go check out all those. Subscribe to my BitChute channel, Odyssey, if you want to go there. That's like my least viewed one, but you can go to either any of them so that you can start your journey. I would like for you to also, while you're at whenyouneedafriend.com, to share this information with your friends, your family, and check out my sponsors. Support my sponsors the way that they're supporting the classroom. Make sure that you do everything you possibly can to get this information out. So whether it's share this video, put an emoji, make a comment on Facebook or YouTube or Instagram, wherever it is, make a comment because the more you share, the more you make comments, the more emojis you put in, the less the algorithms can gobble the information up. So just please help me grow the classroom. Another way that you can help grow the classroom is you can become an enrolled student in the classroom. So whether it's $1 or $1,000 a month or a one-time donation, it doesn't matter what it is. Like I said, it could be $1, one-time donation of your time, your talent, your treasure. All of that is so welcomed. We have so many different past do-it-yourself webinars that you can check out. We just did the one with Dr. John Silva for rewiring the brain with neurofeedback training. So I'd like to encourage you to check out all my workshops and everything that I do that is recorded that you can get at any time and watch at any time. So I am just really excited about that. So please remember to support us in any way you can because it's become more and more expensive for you to watch a free class that you can trust. And so please do whatever you can to help us grow. Today we have Dr. Claire Stagg, and as you can see, here's her information. Her number is 321-777-2797, and you can find her at healthconnectionsdentistry.com. Dr. Stagg, I love everybody in your office. They're all so caring, so kind, and I especially love how much you care. So, I mean, you could be anywhere, you could be anywhere, but you choose to be here educating. So shares, if people have questions, can they schedule a consult for like a second opinion, or can they come see you? Do you do anything virtually?
Well, I always say that I'm the last resort. A lot of times when patients have one foot on a banana peel and the other in the grave and nobody's been able to help them, it's always because I like sleuthing things out. And that's where I think the challenges are. It's it's using my brain as no longer just my hands. And I think a lot. I love sleuthing things out. I really like connecting the dots. I think that's what's so exciting. When I went through pre-med, I was actually accepted to medical school, and I was so worried that I wouldn't be able to treat people the right way. And told me, you do dentistry, and lo and behold, I actually help more people with what I do as a dentist, the type of dentist that I am, when I treat the whole body through the mouth, than if I had gone through medical school.
That's awesome. That's awesome.
Yeah.
So let's talk about your book that people can get at
Yes.
Amazon. Where else can they get your book, Dr. Stagg?
We have lots at the office also. I have a nice collection here at the office. I also have Captain IFBI, my little guy.
Yes,
Captain had re-edited or republished in 2024.
yes, yes. Why did you write this book, Dr. Stagg?
Whoa. I think it was a culmination of all the knowledge that I had that I kept repeating over and over. And I spent thousands of hours learning everything. I mean, I graduated in 1982, not to age myself, but I did graduate very young.
Well,
So,
graduated from dentistry in 1982?
I was
Okay,
23.
okay.
Yeah.
Very good.
Yeah. So I was very young, and the French system's different too. So with everything that I learned, I found that there were so many mentors that tutored and mentored me, and everybody has their own wheelhouse, and they're very, very good at what they do. Just like Dr. Al Fonda had his thing, just like Weston Price had his thing, just like Standard Process or Dr. Royal Lee had his thing. They were all three dentists, but they're all in the beginning of the book. And what I did is and then my thesis, and then all the thousands of documents that I found to
Mhm.
try to prove what I was trying to show with my research. It was like, okay, how can I help more people to where it's easy for them to go have their own aha moments
Mhm.
alone without having to deep dive. I did the deep diving for you. It's all in one location. You
Yes.
could open it up. It's an encyclopedia of references. There's over 356 references. It's scientifically documented, but it's written for the layperson. It's written as a mom for other moms. It's written for patients who had all these questions they were never able to have answered because nobody ever took the time to learn the answers or the training, and or nobody has the time in the office to go over
Well,
these things.
absolutely. And and you are very unique. And unless somebody wants to fly over to Florida and go to India Atlantic, which is beautiful, that is a beautiful area to stay there and come see you because this takes time. It takes time. It's not like they're going to go in and walk out with a solution. I mean, with the conclusion of their solution. So
All
let's
right.
talk about solutions. What are some of the things that I mean, we've talked about TMJ and what I'm doing, and this is just my lower orthotic, my upper orthotic. I will always wear to bed, according to Dr. Stagg. I will always wear that one to bed, or when I'm laying down. And so sometimes I even take both of them with me in the car when Robert's driving Miss Daisy, and I get to take a nap. And so it's very
Good
important
job.
that we do. Yes, we do everything we possibly can to stay in alignment. However, not everybody has someone like you in their area. So, what are some of the solutions that people can look at, or if that can't come to see you?
So the first thing I would think of be to go to figure out if you can find out if you have a good chiropractor, for example, somebody who can find out if it's ascending or descending, find out if you have sleep apnea. You could always go ahead and have somebody, a physician diagnose you with sleep apnea and then treat you for sleep apnea. Find out if you have a good dentist who can restore your mouth to the point where it's level. All right. There's certain articulators that I think that are the most amazing articulators that they don't make anymore that are called the Aculiner. I talk a lot about that in the book. There are a lot of institutes, a lot of doctors who've started groups um, to where they can teach. And I'm hoping that by next year, I can also have my school up and running to where I can help teach doctors to, very succinctly. I did a podcast with a doctor in Denmark. And he said, "Well, what do you do?" I said, "Well, I do an exam." And the exam usually take me a first hour and a half, but that's to get to know the patient. My actual part, I spend more time listening to what the patient says or doesn't say in compared to the actual in the mouth part. But even my in the mouth part, used to be a heck of a lot longer, but now I do it so much, so often that it might take me 10, 15 muscles minutes, but I would have palpated 15 to 20 to 30 muscles. And he says, "What? How could you do that?" And I said, "Easy. Boom, 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 boom." In 5 minutes, I'd enumerated all the muscles I had done. All right, or less than that. I mean, it's because you do it so often. It's like repetition. When you go to the gym, you might take 10 minutes to do two sit-ups, right? But at the end of a month, you could do I don't know how many repetitions, boom, 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 right? It's the
Mhm.
same thing. So my goal is to enable people to understand, to be their own diagnosticians, to find the strength, the issues within, and then they could go, okay, this is what I have. This makes sense. This resonates. Okay, now who do I go see for my airway? Who do I go see for my neck? Who do I go see for my hips? All right.
So when you go to a chiropractor, let's say for example, are there chiropractors that understand what you're doing? Are there other doctors that have been trained like you have that people can go to? So how does that work, Dr. Stagg?
So the chiropractors that will do this, there's three of them. One is the Atlas orthogonist, one is the NUCCA, NUCCA. All right. And the third one that I personally like the mostest or a lot are the SOT chiropractors, sacral occipital therapy, because they're a lot of them and they follow through with a lot more training. They're the ones that are going to go ahead and see the connection between the hips and the neck.
Perfect,
And they
perfect.
also will see the connections with the jaw joints.
So
The Atlas orthogonists usually have additional training, that's all.
yeah, so the SOT, those are the
Sac-
chiropractors.
Sacral,
Uh-huh.
occipital, so it goes from the sacrum to the occiput
Hmm.
therapy or technique, SOT.
And do you currently work with someone like that in the
Sure.
area? Yeah.
There's actually one that I love next door. His name is Dr. David Sanders. He
Hmm.
actually did a lot more training in neurology, chiropractic neurology. So, which is really cool because when I'm working with my patients, when I do my exam, I do a neurological exam, right? I
Hmm.
told you I worked with all the cranial nerves and I worked with all the cervical nerves. So when I go ahead and I see, for example, if I'm checking the visual, and I see that there's saccades or there's an issue with their acuity, with their vision, I'll say, okay, then we need to go ahead and have you see Dr. Sanders, for example. Or, who's your chiropractor? You might want to let them know that XYZ is off.
Yeah, or they can buy this book. They can buy
Or that
Smile. It's
too.
all connected and bring it to their doctors. I just want
Yes.
people to know what they're getting into when they're coming to see you. I don't know if they could compare you to anybody else. Do you have somebody else that you would say compares to what you're doing, like a physiatrist or, another doctor specialty wise? or no?
So I'm sort of like the mishmash of them all. I've taken the pearls from all the fields and I have the understanding how they work and
Uh-huh.
what I could incorporate into my practice, I do within my wheelhouse because in theory I can only work from hair up, right? So
Yes.
from the neck up. So if there's something that I can do, I will incorporate it. I got all the pearls from everything that I learned, but I also have the knowledge to know what I cannot do, and then I'll refer them with the understanding, okay, this is what I've done. I've prepped you. Now go see Dr. XYZ so that they can now have an easier time. So, for example, if I put the orthotic in, your bite will now be level, your atlas will hold more easily.
Yes, and that is something that I've noticed as well. I
Mhm.
have Dr. Claire Stagg. I want to encourage all of you to go support
Thank you.
her, go check her out, check out the book, get the book at Amazon or call the office at 321-777-2797. You can reach out to them at our healthconnectionsdentistry.com. They're on 2120 Highway A1A in Indian Harbor Beach, Florida. And it is a wonderful trip to go see and go through the process. I've loved the journey with you. So thank you so much, Dr. Stagg, for everything
You're
that you
welcome.
do. And
Thank
please
you.
remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lily McDermott and Dr. Claire Stagg wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.
Ever.
Good job. I love your ever with your Trini accent.
Yes, my Trinity accent.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.